All right. Good afternoon, everyone, or I should say good evening. Thank you guys for signing in today. Today, we're going to go over kinesiology of the hip. Okay, so we've gone over the foot, ankle, lower leg, the knee, and now we're going to go over the hip and kind of put everything together and see how they all relate to one another. So let's go over the bony anatomy here first for the hip joint. So first off, what we typically refer to as our pelvis does help make up our hip. It's comprised of three different areas. As you can see here, we have the ilium in red, the ischium in green, and the pubis in yellow. So typically, if you ever put like your hands on your hip and you feel like that big bony crest that you rest your fingers on, that is your iliac crest, which is that nice round thin edge there, which is part of the ilium. Your ischium is your more so you could say posterior and inferior aspect of your pelvis, and if you're looking at the pubis here, that is the most anterior aspect of your innominate bones. Okay, and your innominate bones are also synonymous in terms of your pelvic bones. Okay, so each of these, an ilium, ischium, and pubis all put together is one innominate bone, and we have one innominate bone on each side. So that's part of the hip here. And you can see how right where my cursor is here, you have this concave surface, and that's what we call the acetabulum. And that's going to be part of the socket, so to speak, that's going to help form our hip joint, which is a ball and socket joint, which we'll talk about here shortly. But as you can see, part of each of these three regions helps comprise that acetabulum. The other part that makes up our hip joint is our femur, which is our thigh bone, and this is going to be the superior or the top portion of our femur here that's going to help us form that hip joint. And you can see here that the head of the femur has a convex surface, right? So that convex, big, round surface fits in nicely to that concave surface of the acetabulum. So the hip joint is actually known as the femoroacetabular joint, meaning so femoro sounds like femur, acetabular sounds like the acetabulum. You put the two together, that's how you get the femoroacetabular joint. So I think this picture does a nice job of really showing again how that convex surface and that round shape of the head of the femur sinks into the concave surface of the acetabulum. So you can see here, this is what we call a ball and socket joint, meaning it can move in all three planes of motion. So it can move in the sagittal, frontal, and transverse planes. You can see this is a very hip joint, and we'll refer to this too when we talk about the shoulder here next time. I'm sorry, in this upcoming weekend. But compared to the shoulder, the hip joint or the femoroacetabular joint is very strong and very stable, but it does not have the same mobility when compared to the shoulder joint. So where the shoulder joint is this second ball and socket joint that we have in our body, it has tremendous mobility, but it's at the sacrifice of stability. So this concave surface of the equivalent of the acetabulum is much shallower, so it's offering less stability. Whereas here with the hip, it's a nice deep concave surface, thus offering a lot of stability. Okay, so let's look at some movements of the hip here. So first off, we're going to look at flexion. These first two videos here are going to be of flexion. The reason why I have two videos is because there's a difference depending on the position in which you put your knee. And I'll explain why in a second. So if you see the first one here, my knee is extended straight. I even have my foot dorsiflexed a little bit there, but I'm raising my hip straight up. All right, so it's almost like I'm doing a straight leg raise, right? But then in the second video, you can see I'm bending my knee, and I can bring my knee and my thigh much further to my chest, so thus I'm able to get into more hip flexion. Reason being is that when you bend your knee, you take your hamstrings out of the equation. By that means said, right, your hamstrings are the limiting factor in terms of how far you can go into hip flexion in the first video, right? So they're the reason why I can't keep going farther, because they limit my flexibility, whereas in this picture here, because I'm flexing my knee, I'm able to bring my hip into more hip flexion. Excuse me. And then, so that's hip flexion, right? So when I'm bringing my hip and thigh and knee, everything closer to my chest and to my body. Opposite of that is hip extension, so when your hip is going back to its starting position here, or when you're bringing it straight back or behind your body, right? So you can see even when my thigh is lifting up off the ground, at that point, that is when I'm going into hip extension. All right, let's go ahead and look into abduction and adduction. So again, similar premises here when we talk about the shoulder later on, but with the hip here, abduction is when the hip and entire leg are going to swing away from the body, and adduction is when the leg is going to return back to its starting position or even cross the midline of the body. So if you look at this video again here, again, swinging out, abduction, swinging back in and across is adduction. All right, so out is abduction, in is adduction. Always think when it's coming back in, think of it like you're adding something, back to your body. So that would be adduction. Then lastly here, we have internal and external rotation. I think it's a lot easier to see here compared to standing when I'm doing with my knee bent like this. So when I swing my foot out like that, that is internal rotation. And when my foot comes across towards the midline of my body there, that is external rotation. So a lot of people get confused with this when the hip and knee are flexed to look at internal and external rotation of the hip. The trick is to not necessarily look at the foot to try and figure out what's going on with the hip. Look at how the thigh and the femur are rotating, right? So if I do this, even though my foot is swinging out, right? So if my hip, even though my foot's swinging out, look how my entire femur, it's rotated inwards, or it's rotated inwards. But now if I swing my foot out, now you can see my whole femur is rotated outwards. So that would be external rotation, all right? So it's kind of habitual. You just want to always look at the feet because it's the easiest thing to look at, and it looks like it's pointing in the right direction, but look at and which way that femur is rotating, all right? Of course, we're going to play through all these. Okay. I want to go over this again in terms of the biomechanical thoughts and with genuvarum, valgum, and recurvatum. So last time when we talked about the knee, we, of course, were looking specifically at the knee. But let's also look at what's going on in the hip here, right? So if we look at genuvarum or bow leggedness, everything's going outwards, right? So in this situation, everything's being turned outwards, everything's pushing outwards. You're going to be in a more externally rotated position at the hip with genuvarum, and you can also see they're going to be a little bit more in a supinated position with the feet as well, right? They're going to have probably tighter and higher arches. With genuvalgum, you can see with the knees and thighs coming together, these hips here are going to be turning inwards and thus internally rotating, and you can see even, especially with this foot here, that they're going to be in a more pronated position. All right, so genuvarum, you've got external rotation at the femur and the hip, and supination with the feet. And then with genuvalgum, we're going to have some internal rotation at the hip and some pronation or flat feet. All right, and again, we're going to look at some exercises in ankles too, where this is going to apply. All right, so let's go ahead and look at these anterior hip muscles here first. And we're going to go through all the different hip muscles surrounding the hip. So first off, the muscles on the anterior aspect of the hip are going to be our hip flexors. All right, so they're going to be responsible for bringing that thigh closer to our body. So the first one you can see here is the iliacus, psoas major, and psoas minor. Those three muscles together help make up what we call the iliopsoas muscle group. These are all very deep muscles. As you can see, we removed our abdomen, all the organs in our abdominal cavity, all of our abdominal muscles, our rectus abdominis, or transverse, etc. So you can see here that these guys are very deep. So you can see the psoas major, which is going to be right here. And then where my cursor is, it's not labeled, but the psoas minor is going to be right here. These two guys are originating on the spine and then attach onto the femur. And then this iliacus is attaching to the ilium, as you can see right on the iliac crest here, and that's going to attach onto the femur as well. All right, so again, because of its attachment on the femur, that's why I can pull on it to bring that thigh upwards to go into hip flexion. Two other small muscles that are going to play a role in hip flexion are going to be the sartorius and the tensor fasciae lata. The sartorius is the longest muscle in our body. As you can see here, it's starting at the anterior aspect of our ilium here on the anterior superior iliac spine, and it comes all the way down and across and attaches into the medial aspect of our knee, something that we call the pezanserine. But this guy's going to help us a little bit with hip flexion. And this other small muscle here on the lateral aspect of our hip is the tensor fasciae lata. Not sure how I got the name, but it's also going to help us partially with hip flexion as well. And remember last time when we talked about the knee, we have one quadricep muscle that's going to help us with hip flexion, and that is going to be our rectus femoris, this long one straight down the middle here, attaching to your anterior inferior iliac spine. And again, all the quadriceps do knee extension, but with the exception of this rectus femoris, it also does hip flexion. All right, so now let's go to the muscles on the medial aspect of the hip or in our groin region. So any of these muscles here that say adductor, they're of course going to adduct the hip, right? So we have the longest here kind of in the middle. We have the magnus at the very top, kind of has two different heads here, so it's at the top, and then this nice big meaty portion down here towards the bottom. All right, and then brevis, as the name implies, brevis kind of sounds like it's brief. It's smaller compared to these the other two there, the two other adductor muscles. The pectineus is very small. You can see here that it is on the right side of this picture, and then the gracilis. It's for some reason it's also kind of on with the adductor magnus, but the gracilis should be pointing to this long, skinny portion right here. That's going to be our gracilis. All right, and that's also kind of like the sartorius. It's also going to attach onto that pes anserine insertion on that medial aspect of the tibia. Okay, so let's go over the posterior hip here. Shoot, there was something I wanted to go over for you guys. I apologize. That's okay. All right, so the posterior hip muscles are really our glute muscles. There's three main ones that we're going to talk about here first in terms of the posterior hip muscles. The glute max is really like our powerhouse. All of these posterior hip muscles are going to help with hip extension, right? So pushing your hip and thigh backwards. So the glute max is going to be the most superficial, closest to the skin, and it's the largest, okay? And you can see partially covered by the glute max, but it's still exposed, is going to be the glute medius. And this is arguably, it's kind of half posterior, half lateral, but it is, a lot of it is on the lateral or the outside aspect of our hip. So that glute medius, along with that tensor fascia lata, is going to help out a little bit with abduction, so bringing your hip away. The glute medius is primarily responsible for abduction, but the tensor fascia lata will also help out with that as well. And then, so if you remove the glute max and the glute medius, underneath that, you can see on this left-hand side here, we have the glute minimus. All right, so again, we're going from max, medium to minimus, so we're going from biggest to smallest. The minimus is going to be the deepest of the three and the smallest. All right, but there's a whole series of other muscles here that they're not showing, which we call the deep external rotators of the hip. And as I'm saying that title there, they all externally rotate the hip. All right, all 6 of these muscles are responsible for externally rotating the hip, with the piriformis being the largest and probably the strongest of them all. So a little acronym to remember them is what we call P-GO-GO-Q. So going from superior to inferior or top to bottom, you have the piriformis, you have the gemellus superior, the obturator internus, gemellus inferior, obturator externus, and then quadratus femoris. All right. All right, so let's go ahead and apply these as well, just like we've been doing with everything else. So similarly, as we talked about with the knee, you need a lot of hip flexion. You need a lot of knee flexion to do a squat compared to a deadlift, right? Same idea here with back squat and deadlift, but it's in a different context, right? So you can see here, the hips are loaded a lot differently, right? So you can see here that we still have a lot of hip flexion for both the back squat and the deadlift, but the difference is, look at how the difference in the knee is going to play, right? So because of how much knee flexion we have, it's going to depend on what muscles we're going to end up using more so, right? So in the squat, we know we're going to use our quadriceps a lot, right? We're definitely going to use our glutes and our hamstrings to help with hip extension as well. But our quadriceps are really going to be a major player in this. Whereas if you look at the deadlift position, there's not as much knee flexion, right? So because there's not as much knee flexion, but we still have a lot of hip flexion, we're going to be putting more stress on all of our hip extensors, meaning our glutes, meaning primarily our glute maximus, and our hamstrings. All right, so let's go ahead and look here. So again, going over this squatting example, right? So kind of first 2 here, good starting position, and then, good form at the bottom, not too much rotation or plantar flexion, or pronation or supination. But if you look here, right, remember last time we talked about the valgus knee, the knee caving inwards, and we have that pronated foot. Well, what also follows with that is an internally rotated and adducted hip. So you can see this whole hip and thigh is rolled inwards and it's caving in towards the midline of the body. All right, so putting this all together, this is what the characteristics of when you have a valgus knee. You have an internally rotated and adducted hip and also a pronated foot. Now, whereas the opposite case, right, if we have a varus moment at the knee, we have varus stress happening on the knee, that femur is going to rotate outwards or externally rotate and abduct, and that foot is going to be a bit more supinated, right? So you can see how I'm trying to create a more of a arch there to try and exaggerate the situation. That femur is rolling outwards, so again, being in an externally rotated and abducted position. So again, single leg squat, very similar situation here. Hip flexion, we still need hip flexion just like with the regular squat. We need to be able to go into deep hip flexion, especially if you're going to do exercise like a pistol squat. You need to be able to get that thigh all the way up to your chest, and if you want to be able to perform that movement correctly. So you can see here, if I have a valgus movement at the knee, you can see how much that thigh is going to adduct and come towards the midline of the body. You can see that my knee is almost directly underneath me. And then you can see on the fourth picture there all the way to the right that my thigh is caving outwards. So you can see how much abduction I'm going to have here. So yeah. Okay, and then lastly we have the lunge. So again, kind of similar to a squat, we still need a sufficient amount of hip flexion in order to get to that bottom position. Probably not as much because we have that back leg in the way and we can't go as far and deep into our range of motion. But again, we still need to be able to go into that hip flexion. And same if you're doing a side lunge, you need to be able to access that hip abduction component in order to just access that range of motion and gain that mobility. Okay, so now let's look at some just basic hip exercises that you may have seen before. So with abduction, right? So if I'm sideline, abduction is just going to be bringing my leg directly up to the side of me, right? So again, everything's away from my body. And then with adduction, a good trick here is to bring that top leg out of the way, and then you can raise that whole thigh and leg up and off the ground. So that way you're going to end up using your groin muscles to lift your leg up off the ground. All right, and then again, just kind of going over this internal versus external rotation of the hip example again, and reiterating not to look at the feet, but actually look at the direction in which the thigh and hip itself are rotating, right? So even though, again, in this third picture here, I'm going to use this for example quick, is that even though my foot, it looks like it's turning away from my body, you might want to think that's external rotation, but look at how my whole femur and thigh are rotating inwards. That's what's going to indicate that my hip is in an internally rotated position. And again, the opposite case for this fourth picture here, my thigh is rolled outwards. It's a little bit abducted too, so I'm going to be in a more externally rotated position. And then you can see in the very first picture here, it's a little bit easier standing, so I'm trying to look like I'm a little bit more pigeon-toed, meaning that my whole entire lower extremity, my femur especially, is going to be rotated internally, and then as my feet are pointing outwards, that's going to be more in an externally rotated position. And then if we look at just again another jumping example, so as I'm trying to jump off the ground, right? So I start in a hip flexion, but then as I try and again leave off the ground, I'm going from hip flexion into hip extension to get part of that triple extension moment. And as I'm landing, I'm going to hit the ground initially in an extended position, but as I'm absorbing the force, I'm going to go into more hip flexion. Okay. Well, hey guys, I appreciate you guys signing on and watching today. And if you guys have any questions, feel free to let me know. We'll be back this weekend to do more lectures on the back and the shoulder on Saturday and Sunday at 10 a.m. Thanks. Ah!